esophagogastric junction distensibility in GERD patients, assessed with endoscopically placed functional luminal imaging probe Endoflip, by Monica A. Kwiatek, Iku Hirano, Peter Karillis, Barry McMahon, and John Pandolfino. And the presenter is Ms. Kwiatek.
Kwiatek, yeah, close enough. Good morning. When it comes to the assessment of gastroesophageal reflux disease, in the arsenal of typical clinicians, there's a couple of tools that are being used to have a look at what is different about these patients, structurally, how bad is the reflux, and what's going on as far as the mechanics of the esophageal gastric junction are concerned. So what we have at our disposal is upper endoscopy, which allows for qualitative assessment of the tissue within the esophagus. Is there any inflammation? Are there any changes in the structure as far as hiatal hernia is concerned? We can use different methods for assessing how much of the acid is entering into the stomach, whether it's maybe non-acidic reflux, and correlate that exposure with symptoms. Of the musculature, what we have at our disposal is manometry, which allows us to assess the contractile function. When it comes to evaluating with manometry the function of the EGJ, it's something that assesses competence, assuming that intraluminal pressure, or at least the increase in intraluminal pressure, is consistent with increased contraction within the junction itself. It is a very good tool at measuring the excellent assessing the esophageal peristaltic function, but it cannot quantify EGJ density. The reason why that would be important is that function actually determines the opening dimensions of the EGJ, and by result, the greater the opening, the greater the reflux volume coming into the esophagus. Previously, there has been a study published which used the hydrostat in order to measure how the EGJ junction can be distended. And in that method, the pressure was being put in renograph, which was injected into the balloon that's placed in the EGJ to see the pressure or the response of the EGJ to the pressure within. Radiographic images were used to have a look at the supine aspect of the EGJ and also the lateral aspect of EGJ. And in the end, what was found out that if at pressures, these pressures are actually relative to intragastric pressures, what you can see in GERD patients with no hernias, the sphincter itself opens at much lower pressures than you would see in normal volunteers. And in people with GERD who also have hernia, that opening is even greater. Therefore, the distensibility in these patients is definitely increased. However, when it comes to hydrostat, it is a technique that only assesses the distensibility of the EGJ by looking at it in 2 dimensions. It uses radiation to actually have a look at what is the geometry of the junction itself, and it's rather cumbersome, so for that reason it's limited to research centers. But the technology is moving forward, and basically right now what we have at our disposal is impedance planimetry. In a nutshell, it's a method where there's 2 impedance electrodes that are encased inside of a balloon. Inside of the balloon there's also a conductive liquid, and when a steady current is being applied to the impedance electrodes, the voltage between them can be measured, and the changes in the voltage are reflective of the changing diameter of the balloon within. The voltage is inversely proportional to the cross-sectional area where the 2 electrodes are. As you can imagine, once you stack those electrodes on top of each other, what you can create is a 3-dimensional image of any lumen that you put the balloon into. So what we wanted to do is to measure and compare the EGJ distensibility with a new tool that's using this technology in controls and in patients with gastroesophageal reflux. For that purpose, we enrolled 20 controls and 20 patients with GERD who were symptomatic of PPIs, but nevertheless were responsive to PPIs. This is a schematic of the probe itself. In the schematic, I actually show the probe being squeezed by the EGJ tissue. It's a very small diameter probe with an infinitely compliant cylindrical bag around it that has the conductive solution inside. And the probe itself has receiving electrodes inside. There's about 16 of them, so they cover a distance of 6.4 centimeters. So we can look at